Well, hello, everyone. Today we have Dr. Selma El Hag with us, and she is a general surgeon at Lima Memorial Surgical Specialist. And she's here to talk about robotic surgery. So thanks so much for joining us, doctor.
Thank you so much, Chris, for having me.
My pleasure. All right, can you tell us more about what actually robotic surgery is?
Yeah, so when talking about robotic surgery, I think the comparison comes with laparoscopic surgery as well. We have come across a lot in the medical field with improvements. So when we're discussing surgery, we're discussing open surgery, which are big incisions, versus laparoscopic surgery, and now recently robotic surgery. The difference is we place ports with small incisions in both cases of laparoscopic and robotic surgery. With the robotic surgery, so when a surgeon is operating laparoscopically, the field of movement that I have across those ports is either up and down or sideways. When we're doing robotic surgery, you have these arms the articulation is amazing. They have great accuracy. They filter the tremor. So it's really a game changer when it comes to the surgical field.
Awesome. Now, can you explain how robotic surgery differs from traditional surgery methods?
Yeah, so you have you have a smaller incision, of course. You have port size can be about 8 millimeters, so that's a sub-centimeter incision. When you're talking about traditional surgery, usually we're talking about open surgery. And we are really trying to go away from that just because of the high morbidity that comes with it. There's a lot of pain, a lot of scar tissue when we're talking about traditional surgery. So robotic surgery, what you expect from patients is they have less pain after the surgery. They stay in the hospital usually less days than with traditional surgery, and they can get back to their normal life a lot faster than with traditional surgery.
All right, because I was just going to ask you about what the main advantages of robotic surgery would be compared to traditional methods, but it sounds like it's just a lot easier, right? It's less recovery and whatnot?
Absolutely, and with traditional surgery as well, the more you touch the tissue, the more you're leading to scar tissue. So that makes any upcoming surgery more difficult. So with robotic surgery, you have better view. You have a 360 view, if you would like, as well as it's a 3D dimensional. So the things that I can see robotically are way different from what I can see with traditional surgery versus laparoscopic surgery. You can see a lot of the layers that are very clear that you don't really see when you're doing traditional surgery. And I think that creates less trauma to the tissue and eventually less scarring, better outcomes for the patient.
Very interesting. Now, what type of procedures can be performed using the robotic surgery technology?
So a lot of specialists use it. We're talking about urology. They use the robot, gynecology. From general surgery perspective, we do a lot with it. We do usually foregut surgery, upper stomach surgery, esophageal surgery, gallbladder, colon surgery. Especially, it's really helpful with colon and rectal surgery just because of the pelvis and how narrow it goes, especially in males. So you can also do thoracic surgery. So you can really do whatever you need with the robotic technology.
All right. Now, if someone is actually interested in learning more about robotic surgery at Lima Memorial, who can they call?
They can call our office, and we're happy to talk to them and talk to them more about robotic surgery and see what their options.
All right. Well, doctor, thank you so much for joining us today. I appreciate it.
Thank you, Chris.
All right. Well, don't go away because we have more when we return.